I'm hoping we'll. Okay. Yeah, I think we're on a quorum, but maybe we'll skip introductions this time. Okay. Oh, well, thank you for joining today's meeting, everybody who's here. There's some interesting happenings that we'll be discussing, and we have a vote. So it'll be a good meeting. Let's start with the approval of August the meeting minutes. So I'm hoping everybody had a chance to look over the draft minutes from the August PHAB meeting, and we'll vote on acceptance of the meetings. Are there any edits that people have to the meeting minutes? Hearing none.
This is Steve Heath. I'll move approval.
Oh, great. So we have a motion to approve. Is there a second?
Second.
Thank you, Libby. Can everybody please enter into the chat aye or nay to accept the minutes?
I only have the option to direct message. Liz, is that fine?
I see.
Are we
that.
doing?
I just
modified it.
Okay, great, thanks. I'll do that again. Well, okay, there we go. Okay. Two messages. Okay. I'm not sure, Liz, if you're seeing something different than I am. Would you like to keep track of this just to count that the votes?
On the minutes?
Yeah.
Sure.
Thank you. Because I'm seeing very strange things on this chat.
Oh gosh.
It's okay. It might just, as long as you're seeing them.
I see everything. Yeah. It's
okay.
Everybody has voted to approve the minutes.
Wonderful. Thank you, Thank you, everyone, for that. Okay, meeting minutes adopted and approved. Just a quick note on, we still have vacancies on the PHAB board. I think there are 3 currently. And we're in the process of changing the website, so it makes it a little easier to find the application and to understand the process. So hopefully that will make, we won't lose anybody interested in joining, and maybe the word will get out a little bit more, but I hope to fill those positions soon. We have 2 PHAB members who are attending 2 of the boards that we actually have representatives to sit on those boards. They have positions for us. And so that's the first 5 and the Human Services Council. So that's a very good thing. Hopefully they'll like it enough to think about it, becoming the representatives for PHAB on those boards. And that's about it for that. I want to thank Dr. Damiano very much for sending the update. That was a request from some PHAB members, and that's very helpful. So as we turn to that update, I can try and actually bring it up now. I think people have it, so we'll just let Dr. Damiano go through it.
All right, thank you. Good afternoon, everybody. Nice to see everybody. Just for a couple of announcements, for the Women, Infants, and Children program, the WIC, we are very honored to receive the WIC Breastfeeding Award of Excellence for its Breastfeeding Peer Counselor Program. It's one of 4 gold awards that were given in the Western region of the United States. And this is also the second time WIC has received that award. So really stellar work, very excited about it. And they'll soon publish a WIC 2021 report. I think some of you, I know Steve saw the last report, which was done a while back. So I'll circulate that to PHAB and have appreciated your support on our WIC services.
I just want to say that we had a presentation, the last presentation from WIC was wonderful, and it just sounded amazing how they were working with this and incorporating the lactation advisors and reaching out to make sure the services actually get to the people who need them the most. It was a wonderful presentation, and so it's totally understandable and very, very exciting that they got this award.
Yeah, we're very pleased. And then this was a year for us to get acknowledged. So on emergency medical services, Dr. Hernando Garzon was named the EMS Medical Director of 2020. I know Dr. Orkan knows him and has met him before by the state EMS authority. So during the pandemic, he actually had a couple of different roles. He worked for us as our EMS director, but he also worked for the state of California, leading some of the COVID work in terms of hospital modeling and other things. So he's a really stellar person and works really closely with us. We were also really fortunate to receive 2 positions through the budget process, a large part of the advocacy done by both the Emergency Medical Advisory Group and by PHAB, who have supported EMS. So we were really grateful for those 2 positions. And then we also got a planner position for emergency preparedness through public health. So EMS, we work very closely with Dr. Kassiri in public health. It's very much a team effort. So we're very pleased, and we're in the process of filling these positions. For those of you who recall, our EMS team is quite small. It's only 7 people. So this will bring up our FTE count enormously, and we're looking forward to it. And then for juvenile correctional health, we received accreditation through the National Commission on Correctional Health Care recently, and that's for our healthcare services that are provided at the youth detention facility. And this is a result of several years worth of consistent effort to get that accreditation. And I'm really thrilled with this accreditation. And we do have some of those managers now have transferred over to adult correctional health. So they're helping us on that side. And for those of you who don't know, at once upon a time, the probation and I believe one other service at the Youth Detention Authority was on a consent decree. So what a long ways they've come. Farla had initially asked me to provide the COVID data for you, which was actually supposed to be the main part of the report. So I have that on here. So for juvenile, I list that. It's a very small facility. It's about 109 for that particular day. And we had 48 confirmed cases throughout the pandemic. We started vaccinations, I want to say in June or July. We now have 59 youth vaccinated. We started an incentive program for the youth in mid-July, and actually probation is supporting that program. So it's going slowly. We have to get parental, informed consent from parents to do this in agreement. For adult correctional health, obviously a much bigger facility, and as the Delta variant has really hit Sacramento hard, and I know Dr. Kassiri will talk more about that, we are starting to see elevations in numbers coming into the adult facility. Last week, we had a net increase of 11. We did 356 tests last week. That's 1 week alone. We were doing tests on possible exposures of inmates, and then also on the newly arriving. For a snapshot in time, we had 13 confirmed cases at the main jail and 2 at the branch jail that we were treating. For vaccination, it's been a hard road for us, oftentimes working with inmates when we try to do preventative health in terms of any kind of vaccinations, influenza, et cetera. We don't get a lot of acceptance as is. So we have tried to do a number of things, patient education. We've tried reapproaching inmates. We've tried to break some of the myths that happen. There's quite a few myths. And then we finally got approval in July, late July, early August from the Sheriff's Department that we could participate in an inmate vaccination program. So what we do there is, I was fortunate, I asked for money from Dr. Kasseri, so it was part of the county general fund dollars to get some money for this purpose, because the sheriff didn't have money for this like probation did. So what we do is, if an inmate is agreeable to be vaccinated after they've had education for the 1-dose series, like the Janssen vaccine, they will get $10 deposited into their inmate commissary fund, their inmate fund. And if they're doing the Moderna or Pfizer, it's $5 per dose. And that happens the next day. So what happens is, when we do vaccinations, we'll have a spreadsheet of people that are compliant. It goes to the Sheriff's Department, and they actually place the funds in the inmate accounts. And then the inmates are able to use those for their own purposes, whether that's more phone calls or food or whatever they pick. This week, we didn't have a great uptake. It was only 21. I think prior week, we had 50 or 60 inmates. So even with the incentive program, it's slow going. We have had some inmates who refused vaccinations in the past now agree to be vaccinated. So we're hopeful, but it is a slow going program. Okay, and then for our staff, I gave you data on that sheet. That's also slow going. This sheet only has the healthcare and the Sheriff's Department. But I can tell you on the health side, I think most of our staff, with the exception of maybe 20 healthcare people, are vaccinated. But we're working through some of the exemptions and so forth right now. Okay, for our current COVID work, we're working hard to implement a state public health officer order, and I did put the link in your document. It was sent on August 19th, and we're required to have full compliance by October 14th. This requires the healthcare staff, correctional officers, inmate workers that are in the jails to have vaccination, just like the healthcare worker public order that happened recently. So for our health staff, it's pretty easy. Like at the youth detention facility, all of our staff are vaccinated, and in the jails, I think most of our healthcare. But we still have a pretty great number of correctional staff that are not vaccinated, and inmate workers. We are continuing to offer to vaccinate them on site so that they do not need to go to any community clinic for that. And I sent out another email on that today. I had staff sent out an email. We also, through our human resources, have implemented the vaccine verification system. It's called Qualtrics, and staff are now loading into the system copies of their vaccination card, or if they have an exemption, we need to know that. For those who are not vaccinated or will not disclose they're vaccinated, they are going to be required to complete weekly testing. And that testing will be on site for the jail facilities and also just adjacent or near the youth detention facility. Liz Gomez, who is our staff on this committee, is actually the person that's doing all of the setup and organization for those community test sites. And so right after this meeting, I've convened another meeting. This is our second one of all the command staff, which are the custodial staff at all 3 detention facilities, Liz, and some of our health staff to work out the final logistics of these testing sites. And I know it's probably hard for her because these are more challenging places to work than some of the community sites. So that testing will be rolling out fairly soon. And then the last thing I heard Farla was interested in is that there was a board item report in March on the Annex facility, the Correctional Health and Mental Health Facility, which the board did not support at that time. Part of the work that came out on that was to have 2 consultant groups, one on the building, and basically what would the population need to be in the main jail for it to work for us in terms of ADA compliance and the necessary health and mental health services. They're currently working on that report, but there's no timeline at this time. The second consultant report, which I think is a group of consultants, is looking at population reduction. I believe they're looking at data, not only from the criminal justice perspective, but also from the mental health perspective of inmates. And that one is in the really early stages and probably early 2022. I was a little deflated when I heard that date because I was hoping it would be earlier than that. When those reports are public, or if there is a board item, I will make sure that PHAB gets those reports.
Thank you.
Okay, so that was a lot of information. I don't know if anybody has any questions.
I just want to make another comment on the emergency medical services. It's been very clear from the presentations over the years that that's an incredibly understaffed service unit. And it is truly amazing what they're doing with such limited resources in terms of personnel. So congratulations on that too, and certainly on the juvenile detention.
Thank you.
Lots of kudos there, big kudos, wonderful.
Yeah, for this during the pandemic, so it's pretty amazing.
Yeah.
Dr. Damiano, would you mind explaining the adult correctional health table a little bit more? It says a net increase of 356 on the number of tests administered. I'm not sure I understand what that means.
Oh, okay. So basically, this is a weekly snapshot that we do. It's actually posted on the sheriff's webpage. And so we give an update every week. So in 1 week, we completed 356 COVID tests on inmates.
Okay. So, and then the net increase on the number of confirmed cases is the same. That's over a week.
That's 11 for 1 week. So what happens is when the community transmission comes up, we are seeing more cases coming in through our booking loop. Yeah.
So help me if I'm figuring the math out right. But if I divide 11 by 356, I get roughly 3%, which seems like a very low positivity rate compared to what we're seeing in the community. I wouldn't expect that.
Oh, okay. So partly what you have to understand is that in the correctional facilities, we test everybody. And we test everybody sometimes multiple times. So some of that 356 were people tested before, but we thought we had a possible exposure. So we test all the new arrivals, all the incoming people transferred from other jails, CDCR, and then we also test if there's any possible exposure. So unlike the community, we're not all tested, right? People get tested either because they have some symptoms of COVID, or perhaps they have been in contact with someone with confirmed COVID. There will be more testing happening as people are required to be tested, you know, through schools, et cetera.
Okay, I think I'm following.
Yeah. Anybody else?
Yeah, thanks, Dr. Damiano. I have a quick one, and I apologize if you covered this. I was trying to both read the update and listen to you at the same time, so you may have said this, but I just wanted to hear a little bit more about the report or the analysis that's being done on population reduction for the jail. I know you said we're not expecting that report for some time, but do you know who's leading it? What is the scope of questions they're answering, or the scope of maybe like alternatives or mechanisms they're looking at? Just a little more context would be helpful.
Oh, okay. So I believe it's 2 or 3 consultant groups combined. So I don't have their names in front of me, but they are reputable in the field of criminal justice. And we can get those for, the group later. That's not a problem. So I think part of the issue is looking at the size of our jails and the amount of inmates that are incarcerated in Sacramento County. And I think the desire is, can we significantly or dramatically reduce the jail population? And so I think what they're looking at is to really look at the actual inmates by looking at the charges, looking at the people that have also serious mental illness, for example. Those might be others. Also looking at some of the programs that we have, which are run by, public defender, probation, et cetera, to see could any of those programs, if they're successful, could they expand? I don't have right in front of me that whole line of question, but it really is aimed at, can we significantly reduce the jail population?
Great. Yeah, it'd be wonderful if we could, whatever you're able to share in terms of the names of the consultant groups working on it, or even the terms of reference or whatever, if there's any sort of publicly available document describing that, because I think those themes are coming up a lot in the sub-working group. So just being aware of.
Right. So that work is not work that we're working on actually in the jails, because our work is to care for the people that are there. Sure. I just happen to sit on some of these criminal justice cabinet and these other groups where they're trying to work on that. Obviously, for my purpose as a provider of services, I would love the population to be reduced because that would help me immensely with the work and with just the staffing and a whole bunch of other things. We'll try to get a little bit more detail, but there hasn't been anything public yet on those ventures, but we can try to see what we can find.
Awesome. Thanks. Yeah, if you can just keep us in the loop and we'll figure out.
Yeah, I'm happy to do that.
Thanks.
There's also a question in the chat, Sandy. It says, I have a question about the youth facility. Have we disaggregated the numbers to know how many are vaccinated who are under 18 and over 18? And they're wondering about parental consent impacts versus adult choice.
Okay. So I can tell you that the first people they vaccinated were the people that were of age, that were 18 and above. Adding the parental consent just takes more time to do the consent because you have to reach out to all those parents. I personally do not have a breakout by age. If that is desired, I could ask the program coordinator to provide that. I don't know how, is that a curiosity or is that something that people want?
This is Lynn Berkeley-Baskin. Thank you so much. I'm wondering, I'm also working, of course, with the JJCC, and we're looking just at different impacts based on the fact that we do have a mixed population based on age. Yeah. And so I'm also, I guess I'm wondering how much parental consent prevents children from being protected. So yeah, it would be helpful to know that.
Okay, and then is there a certain age breakout you want, or just for us to kind of group it in certain buckets?
I think just over 18, or 18 and over actually.
Oh, versus, that's perfect.
Right,
okay.
So, right.
Okay.
Because they don't need parental consent, obviously.
Right, no, we can do that. When I have it done, I will provide it to Farla.
Could also that be disaggregated by race too? That would show us hesitation.
Oh,
hesitancy. It'd be interesting to know. Yeah, I will send that out once I get it from Sandy. And Jofal, hi. He would like to know if there's anything that PAB can do to assist in any pending item or issue for you, Dr. Damiano.
Well, I'm sure I will be back for some assistance, and I really appreciate that offer. Thank you.
That always stands, you know that, right? Okay, thank you so much. Oh, Steve has a question.
And then Lori, Farla.
And then Lori, I'm sorry, I didn't see your hand. Thank you, Liz. Great.
Dr. Damiano, I have two questions. The first has to do with the number of COVID positive patients that are brought, that are identified per week. Most of those, I suspect, you're picking up by screening people that are brought to the jail for the first time. But it seems like there's always a case or so of people that are identified in the jail that probably are picking it up in other ways. And I suppose that's by exposure to either other inmates or to staff. And I'm really wondering how we feel right now about the ability to make sure that the staff that are dealing with the inmates are actually COVID-free.
Okay, so that's a lot of questions. We always mark on our data dashboard if we'll have the number of confirmed cases, and we usually have the number that was through intake booking loop. So most of them coming in, we do special COVID quarantine housing for a certain period of time. They're tested during that period of time. The bulk of the cases come out of intake. So that part is easy. I have to say, most of them are asymptomatic. So you would not know except through the testing process that they are COVID. You're right, we do get some that are seen outside of the booking loop. Sometimes those are from transfers. Sometimes it could be from going to different appointments. It could be from staff. It could be from an inmate worker, from a variety of things. So we do contact tracing on those cases, and anyone that we feel is a suspect. We have suspect COVID housing, which we're also placing in isolation for a certain period and doing testing, which is why we had so many tests the other week. It is a challenge constantly in the jails to make sure staff are familiar with protocols. We did have an incident last week because we have we have turnover all the time in the custody side. There was a transfer of a group of inmates. One of them was positive, so that way we had to quarantine this whole housing area. So that meant that nursing had to quarantine and test a lot of people, but it also meant they had to spend 2 or 3 meetings, I think they've had with our custody partners to try to educate and write protocols to prevent it from happening again. So it's a continual process, and I feel like we're revisiting it again because we had a lull, when we were at a COVID low right before the Delta, and then we're having to, gear up for all of this. So it's ongoing work.
So the second part of my question had to do with, I know that the Board of Supervisors has created a new division. Maybe you can talk about what that is and what relationship you or public health might have with that effort.
Oh, okay. So there's going to be a public safety agency. So it will be led by a deputy county executive. And I think one of the questions one of the other members had was about the reducing the jail population, that sort of thing. That person will own those kinds of tasks or goals or lead them. A lot of our people, like the probation department, public defender, will report to that individual as department heads. For the elected officials, like the sheriff and the DA, they'll have dotted lines to that public safety person. I wasn't even on the org chart, the correctional health programs, but they did qualify that and did say that they would need to liaison and work with us because we kind of have a foot in both worlds. We're in the health, but we're also spending a lot of time with the correctional partners as well. I might have missed some parties because the coroner is also in that department. There's several other agencies that are in that department. So hopefully it will provide more focus to important questions.
Yeah, thank you.
Mm-hmm.
Yeah. Lori, you had a question?
I did. Hi, Sandy. Good to see you. My question is not COVID or vaccine related. It actually has to do with your brief report on the youth detention facility because I received some questions, and since I have you here, maybe I can get some clarity. So apparently Judge Borak has inquired with probation whether the availability of medication-assisted treatment for youth is currently available at YDF. I guess the staff there were told that it's being considered, and some of their policies and procedures are currently being updated to include medication-assisted treatment. So I'm just curious as to if there's been any new developments about that, just so for my own knowledge and my team's knowledge, and what medications are being prescribed if that's the case.
Okay, so on the health side, we just have the one provider, I think, one or two providers that weren't currently X-waivered, and we did talk with them. Pam Gandy Rosamond, who's nursing director, and I talked to them. So I don't have the latest. What we told them is that they will need to be dealing with this, particularly as the populations are growing, some of the ages that I believe Lynn talked about. They will need to be prepared to provide that continuity of care for these youth and young adults. So we can probably get you more information later, Lori, on that, but that's what they're currently working on.
Okay, great to know. Thank you.
Mm-hmm.
Thank you for that. Very informative. Good discussion. Good questions too. So we're going to move on to our public health update. And before I let Olivia speak, I want to just honor her again with another mention of another award that we have for the county. And Dr. Cassirier was awarded the Power of Voice Award, which comes from it's a local communications honor, and it honors a single powerful voice who has brought inspiration to Sacramento County residents. And it's an award for the voice of what Dr. Cassirier has been doing. And that's, she's been the voice of life-saving information and instruction throughout the COVID pandemic. So they've recognized her as this year's most important and prominent communicator. So congratulations. That's that's great that you're getting recognition. It's been quite the event, this pandemic, and what it's done for what public health has done in the midst of its understaffed and under-resourced entity that you are, that we will address later in our priorities. But congratulations.
Thank you. Well, I'll try to keep my presentation brief or update brief, because I know you do have another presentation. I'm hoping that you all do have access to the dashboard, but wanted to spend the time just letting you know what we're seeing in terms of what the numbers mean. We're getting about 500 to 600 cases per day. Yesterday, we did have quite a blip, about 3,000 new cases. Part of that is due to a backlog, but even without the backlog, about 1,000 cases. So that was a little bit of a surprise. We're still looking to see what was going on there. But when you look at the dashboard, it still does look as if we're on a plateau, but it's very tenuous. So I don't know if it's going to go on any higher. One question I've been asked is whether we're seeing a lot of additional cases from students now that they're back in school. We are seeing an increase, about a 10-point increase in cases from schools, but it's still overwhelmingly the young adults, the cases that we're getting, with the new cases. When you look at hospitalizations, especially compared to the winter peak, we're actually almost at the winter peak. And so Sacramento region has been hit hard with this last wave compared to all the other regions. And right now our hospitals are quite full, over 400 total, and over 100 in the ICU. So we meet with them on a weekly basis. And it seems like they're doing everything that they can in terms of if they're able to use surge beds, but part of the issue that they have also is some difficulty with staffing, making sure that they have enough staff. So those are two things that are really hitting them hard. And I know that in PHAB, you have had some interest to talk about the wall time. And of course, with the EDs being so full, that has gone up. And in fact, there have been times where they've had to do diversion in some hospitals for a brief time, but they've been able to really coordinate very well together and also coordinate with the MS to keep everything going. But we did have to put out a plea to the public because one of the concerns that the hospitals had is that they were also getting people walking into the ED asking for a COVID test. And so there are other places where people can get a COVID test. And so wanting to make sure that we reserve the resources just for true emergencies. So we're continuing to monitor. I think that's one of our highest areas of concern. In general, when you look at all of the counties, and especially compared with the vaccination rates, the regions with the lower vaccination rates are the ones that are being hit the hardest this time around. So Northern California, and then Sacramento region, and then San Joaquin region. So Bay Area and Southern California seem to be faring a lot better, and they actually have, when you look at vaccination rates, they have much higher vaccination rates. In general, also when you look at our vaccination compared with the cases, and actually we have added that to our dashboard, so I'm hoping that you are able to look at that. But you can see that 80 to 90% of our cases are among people that are not vaccinated. That's the same with the hospitalizations and the deaths as well. So still pushing out the message, please get vaccinated. This is our best opportunity to be able to beat this virus and to get through this surge that we have right now. Lastly, with the schools, we have a team that's working very closely with the schools to make sure that we're able to coordinate with them with quarantining and being able to make sure that when they identify cases, that it does not grow into a large outbreak. And so far, the schools have been able to manage, but I think it is a strain on them with having to do all of the contact tracing. So we're providing help as much as possible. One area that is of concern is right now with all of the increased testing in general, there is a shortage of the Binax Now kits, which are used for antigen testing. The advantage of the antigen testing is that you can get results within 20 minutes as opposed to the PCR that needs to have the specimen sent to the lab. And then it takes about 24 hours to get the results. So that is impacting not just the schools, but also the other businesses and sectors like the health sector that has to implement the testing for people that are not vaccinated. So still a tenuous situation overall. In talking with the state, it does seem like by the end of September that we will have passed the peak because they are seeing that many of the other regions are peaking. So we're just holding on, waiting for that peak to occur. But in the meantime, just trying to make sure that we're able to continue to provide resources. And I said lastly, but this is my last point. We are continuing with our efforts with vaccinations, especially for the zip codes where we have low vaccination rates. We have seen a lot of progress, especially in South Sacramento. There's a group of community-based agencies that came together, and they've been having the once a week vaccinations at Pennell Center. And each of the CBOs was actually doing door-to-door outreach in the zip codes that had low vaccination rates to get people out. And actually they have been successful, and all of those zip codes, the vaccination rates are over 50%. We still have work to do in the northern part, in North Highlands and Del Paso Heights. So we're working with our partners to make a huge push for the month of September to be able to get something similar happen in the North Highland region, to be able to encourage people to get vaccinated. And we've been working with Supervisor Desmond, who has been, supporting us a lot in terms of being able to come to some of the events and get people out. I was asked a question about using billboards. We did use billboards before, earlier on in our vaccination campaign. We have not been using them that much right now, because what we have found to be most effective is that one-on-one relationship, people going door to door, or having what we call vaccine influencers, which are people, lay people that are given the correct information about the vaccine, and that then they're able to talk to their communities about a vaccine and dispel some of the misinformation that's out there. So that's been our main strategy right now. So with that, I will stop and see if there are questions.
There is a question in the chat. Andrew asked, any talk of CDPH opening another surge field hospital like they did at Arco Arena last year?
No, there is no talk of opening a field hospital. One, because the last time when they did that, they felt that it was underutilized. And so there, and the other issue also is that everyone is struggling to be able to get enough staffing. I think nurses are on high demand, and so they are able to pick and choose and what they will take. So, and of course, everybody is looking for nurses. So it's made it very difficult. And so the staffing would be difficult for something like that. What they're working more on is being able to, if patients do need to be moved to a different area, different hospital, that they're able to coordinate that. Not really related to COVID, but Barton Hospital did have to evacuate because of the fire. And I think that some of those patients may have ended up in Sacramento as well.
Thank you. There's another question. Steve wanted to know who will monitor nursing home compliance with vaccination mandates?
The nursing homes are overseen by the State Department of Social Services. And so we in public health, if there is an outbreak in a certain facility, we can request the records. And what we have seen actually, even in general, we did a survey at some point earlier on in the year, and we found that the residents have very high vaccination rates, like 90 to 100% vaccination. But with the employees, it's about 60%. And I don't know what the impact is going to be with the vaccine mandate. So we'll have to do another survey later on to see what's going on. But they also are struggling with being able to maintain their enough staffing.
And there's another question. Do we have a high rate of children who are being hospitalized?
So in Sacramento, we do not. We do have some children in hospitals, and we have had some deaths, but fortunately, we have not seen that huge surge in hospitalization for children that we're hearing about in the Midwest or in places like Florida. So we'll have to continue to wait and see, because the schools just opened recently. And so we are seeing an increase in positives because of that.
Okay. Any other questions? No. Okay, thank you so much.
Thank you.
Really appreciate the update. Okay, so the next agenda item is dealing with PHAB's top priorities for the Sacramento County's 22-23 budget. We've been asked, and all the boards have been asked to do this. So it's good to know that they want our input. The budget is, want to let you know that the budget hearing, another budget hearing after the state revised its budget, the county looks again at its budget, and that will happen next week. I think it's on September 8th. Correct me if I'm wrong. And I will make sure to send out a link to that the information for the meeting. You can either, I guess it's televised, so you can watch on television or on the web. You can also listen to the recording afterwards. And so those links are on the county website, and I'll send that out after the meeting. I hope people might have the time, hopefully, to check in at some point with those hearings. And they're looking for input, and here we have an opportunity to influence, you know, some of their priorities. So we had some, I had some response from my request for people's top priorities. And now we have an opportunity for everybody else to weigh in. And hopefully at some point, I'll distill those suggestions down and we can vote. Initially, the deadline for submission was on September 9th, but I think it's been extended for us. So we have a little bit more time. So we can, you know, spend the time discussing today. I can send out the results in some format, and I guess and people can then submit their votes by email, and I'll compile that. Unless, of course, we wind up with enough time and input today to come to some conclusion. But I'd like to open it up to anybody who would like to suggest some other areas. I guess, I think I sent out last year's topics that were suggested in terms of all the nominated topics and the ones selected. Things change. People change their priorities in terms of what they're seeing as issues in the county. Let me just read some other suggestions that came in, and so people can think about those before we open up the conversation as well. So from a public health perspective, in general terms, this person was suggesting expanding mental health services within correctional health, additional resources for alternatives to incarceration, need to expand healthcare access to vulnerable populations, not just mental health, but screening for HIV and HCV, syphilis, medication-assisted treatment and sexual health, as well as case management services and resources, housing for the homeless, and management of outbreaks in vulnerable settings like correctional health on the planning side. In addition, some others were behavioral health continuum of care, Sac County public health infrastructure and staffing, climate change and impact upon vulnerable populations, in particular wildfires, homelessness supports and services, COVID-19 and general emergency response preparedness. There's no end to the topics that need to be addressed. So we have, I'll open it up now and see. Lynn has her hand up.
Thank you so much. I'm just curious if PHAB will be aligning with climate and health equity.
I think that was something that we looked at and voted on last year, I believe, or maybe not to health equity, but we can put that down. Thank you for noting that. It's certainly an issue that's of utmost importance now with what's going on with our climate change and the disasters that we're facing. So I'm particularly concerned also with, wait a minute, wait. Lynn, did I misunderstand your question?
No, I don't think so. You said, I said climate and health equity.
Okay, so, all right, that's fine.
Is that okay?
I think, yeah, did that not come under the climate change and impact upon vulnerable populations? Is that?
It might. I was just asking if there is an alignment there.
Okay, all right, I will add that to health equity. Okay. Libby? You have your hand up?
Yeah, sorry, it takes me a second sometimes. I was actually just wondering if we could hear from Dr. Kasiri and Dr. Damiano, what are their top 2-3 priorities for the year ahead, and a slightly different question of what do they feel is the most underfunded or under-resourced, which might be different than their top 2-3 priorities, but would love to hear from them to shape our thinking.
I'll let Dr. Damiano go first.
Oh, thank you for that, Olivia. The top 2 to 3 priorities, one of them, which would not be surprising, is adult correctional health. That in terms of my priorities for the workload that we have right now, which is really internally very challenging. One of the things that you may not want to support is actually space, because I think we are going to need some additional space, even if we can get the jail population down. It's just not a place that's conducive to healthcare in the jails. For underfunded programs, that's also really clear to me. It's my emergency medical services and our WIC programs. Those are the two that don't have extra funding streams, and we're always trying to scrap enough together to make sure that they have sufficient staffing. So thank you for asking.
Yeah, really helpful to hear. Thank you.
Yeah, thank you for asking. It's a bit difficult to narrow it down to just a few, but and Linan is on the call, so she could add in her thoughts. But the ones that come to mind the most, of course, right now it's the COVID. So that's a given. But I think related to COVID is also looking at the health equity issues, because I think one thing that has really been highlighted during this COVID response is how disparately communities have been hit by this. And for communities that have more resources, the impact was less. They were able to get vaccinated. They have much higher vaccination rates, much lower COVID cases and case rates. But when you look at the vulnerable communities, the impact was much greater. Their recovery is going to be a lot harder. And so I think public health being able to continue to be a part of that recovery and being able to help communities to become more resilient. And in that group, apart from the communities of color that we often think about, I also want to add the homeless, and I know all of you are very aware of all the issues with the homeless. It has really, number of homeless people has increased. And I think that being able to put focus on getting these residents out of the conditions that they're in into stable housing is the most important, but also to give them the support that they need health-wise so that they are successful, I think is important. The other area that I think about that we've been discussing with Linan is with community nursing. Being able to have nurses, what we used to call field nurses, but now we call them community nurses, but having a team of nurses that would be able to provide more support, because oftentimes we get calls from hospitals where they have just seen a child, they're kind of worried about the child's health, kind of failure to thrive, and so would really, you know, they're looking for someone to keep an eye on that child in the home. But right now we don't have a field nursing unit. And so being able to reestablish that, I think would be important. Also to help with providing support to the agencies that are providing services to the homeless as well. And then lastly, STDs. I think it's kind of fallen off of a lot of people's radars, but I think we still have a huge STD problem. We have been able to get additional funding to expand our STD clinic and to be able to provide services, especially to those that fall through the cracks, especially the youth and other communities that feel marginalized, and being able to have services that where they feel comfortable, I think is important. And also, of course, with HIV prevention as well. Linan, do you have anything to add to that?
The only other thing that I would mention, I think you covered most everything, Dr. K, but I would also mention CalAIM implementation and just us, you know, helping to ensure that providers that are selected as, you know, and who the health systems are going with, health plans are covering the populations that need to be covered, and see where like those gaps are, and how we might help to bring folks together just to make sure that those networks of care are adequate for the underserved.
Thank you.
That's it.
Can I jump in with a follow-up question?
Yeah,
If
sure.
we have time.
And Joe Phil has his hand up after you.
Okay, I was just interested to hear from Dr. Kasiri quickly. You talked about community resilience and protecting vulnerable communities. Just practically speaking, to help me wrap my head around, like what would that look like in terms of budget lines or activities or interventions? And if you don't have the answer to that yet, that's fine. Just curious if you have ideas.
Actually, I do, because we've actually, even prior to COVID, we had started doing that with the Black Child Legacy. The board did approve, I think it was 10 million total over a 5-year period to be given to 7 communities, and done quite differently from the way we usually do the programs with the money that we get from the federal government and the state, because usually they give us a scope of work, they tell us how many people we can hire and what we need to do. But because this was general fund money, the onus was upon those communities to actually come up with the strategies that they felt they needed in order to be able to address in this case, it was looking at child deaths. And so they did that, and it looked a bit different from each community based on what they came up with. And so even with the COVID-19 response, one of the things that helped us to be very successful with being able to get vaccinations out to the vulnerable communities was working with community-based agencies and working with the communities themselves they were the ones who have been going out and doing the door-to-door knocking and getting people out and convincing them that vaccination was a good thing. So building onto that, our hope is that we will be able to continue to work. We've now have a stakeholder group that helps us with, and they've actually been meeting weekly to help us with developing some of those strategies. And our hope is that as we go along that we'll look at strategies for being able to help with recovery and also to be able to help with, again, the resilience, because we know that there are other emergencies that are going to come along. So how do we help communities to be able to weather the storm and be able to recover a bit better?
Great. That was really helpful. Thank you.
So I think Steve had his hand up before Jofel. So it's Steve and then Jofel. Thank you.
Thanks. As you know, I sit on the Medical Dental Advisory Committee as well as this group. And that's another area that's kind of been below the radar during the pandemic, but the access to dental care has always been tough. There are some proposed changes being proposed by the state administration in the way Medi-Cal is covered. They want to move out of the managed care model that we've had here in Sacramento County into a fee-for-service. Could be disruptive to networks of care. It's something I think this group ought to keep an eye on. And my recommendation is we bring in Deborah Payne and Jonathan Porteous, who co-chair the Dental Advisory Committee, to update us on what's going on at some point during the year.
Thank you. I will put that down and reach out to you about that. Jofel?
Hi, good afternoon, everyone. Thank you again for this. I'd like to just hopefully invite PHAB and Dr. Damiano, Dr. Kasiria, to see if we can have the new executive officer, Ann Edwards, join one of our future meetings. I think it'd be good to engage with the new county executive. She comes in very well received, but also a lot of responsibilities kind of left on her plate from her predecessors. So that's one thing. Second thing is hopefully inviting Cindy Kavanaugh, who is the director of homeless initiatives, to a PHAB meeting. She had a pretty well-rounded presentation on homelessness funding and system update earlier in April 2021. One of the things that I wanted to kind of bring up is that there is a little bit of a system improvement and collaboration on different disparate efforts. I just hope that we're, really maximizing our finite resources and not just throwing things out there, hoping it would stick, because there is such a large population that is resistant to care. And with the mayor and now the governor putting in more resources, it just seems like we're only seeing the increase of the homelessness and resistive care population. So if that's something that we could take a look at. And then the other thing that I'd just like to bring up is that San Diego County earlier declared public health misinformation as a public health crisis. I think Supervisor Nathan Fletcher, former assembly member, did that. And so I really do believe that health misinformation could potentially downstream impact. We've seen so many folks who've been denying the efficacy of vaccines. Granted, that is their own choice, but they're also choosing to die. And there's so many of those folks that are coming through. So I don't know if that's like Darwinism that's working, but at the same time, there are a lot of people that are following them, which is heartbreaking. And, if not for you, then for the people who are unable to vaccinate. And it's just, a little bit disappointing that sometimes even some of our county leaders are helping spread misinformation. So again, I'm all about individual liberties and freedoms, but I think there is a fine line where misinformation could also potentially be, not just distasteful, but harmful to everybody else. And so, I live in Vineyard, and the folks across from me, they're running out of those horse medicines, and it's unfortunate that there's a negative impact to the equestrian businesses as well when it comes to some of these fake news. So that's just my 2 cents. Appreciate it. Thank you so much.
Jofel, do you see some way for PHAB to address this misinformation? I mean, I agree with you, it's terrible, but I'm not sure what our role would be.
I'm sorry, I don't have a really kind of an answer, but hopefully just helping provide the positive messaging that our county health officers have already been working hard. And then perhaps in our own different roles, maybe sharing that information either in social media or somewhere else that we can help elevate and continue that positive narrative. But what I would say is that Dr. Caseria, in my day job at SACRT, she provided an hour or two of her time talking about the FAQs, especially we have a large number of folks from different communities, ethnic communities. And so seeing somebody who's culturally representative of where they're coming from, I think helped kind of curtail our numbers. So I think that's something that I've been very thankful to Dr. Kassir and her team about, because they're really having a culturally competent model of care, especially with sharing information on the vaccines.
That's great.
I just wanted to point out actually that because of the work of PHAB, we do have the community forums. We were having them twice a month, but now reduced them to once a month. But at least the feedback we're getting is that that information has been helpful. And we've had one of the infectious disease specialists from UC Davis on that call, and so being very helpful in being able to address some of those misinformation. Also want to remind you that you are an advisory body to the Board of Supervisors. So if that's something that you feel strongly about, you can draft a letter. And it doesn't need to necessarily point at any fingers at anybody, but just to state that, you know, the issue about misinformation.
Yes, we can do that. And I'd like to just mention that that was, I was going to bring up the forum. It's, we are very grateful to Steve Orkan and Paula Green for instituting that, for starting it, and for the county to be so on top of it for all this time. I've attended many of them, and they are really terrific. And they really seem to reach people who have serious doubts. So that's very effective. Okay. Anyone else? Other comments? Other suggestions? Okay. So we have a lot of topics here. 5 is a very low number considering all of the priorities that are there. And I just want to say also, I do agree with the STD issue that Olivia raised. I did speak with Stacy, who has presented to the board before, and she's going to come probably November, December to present an update. And once the report is out, they have been seeing increases again, and the county is particularly high in their rates of STD. This has been an issue for a long time, and there hasn't been enough resources to address this, and it is a critical issue. Especially seemingly around COVID. I'm not sure, but some areas outside of this area have suggested that COVID has made it worse. So we'll have to address that. It's a little odd for me to bring this up. I think that I can make a list instead of voting here. I'm not. I'll make a list and send it out to the members, and people can rank the 5. I hope that's not in violation of the Brown Act, but I don't see a good way to do this otherwise. I don't want to delay it for another meeting because we were asked for this list. So if anybody has any other suggestions, otherwise, besides the ones I've sent out and the ones you've heard in this meeting, please let me know. Or another suggestion about how to count these votes from our members. No, okay. So then I'll just assume that this is an okay way to do it, that I'll just compile a list of all these topics and send them out to you. And I ask that you send them back as soon as possible so we can send our priorities to the Board of Supervisors.
Farla, I can touch base with, I think Steve said the votes would have to be sent to me. Let me just, we had a Brown Act training and I just want to touch base with our county council to make sure I understand what that is. And maybe you can, once I get that info from him, it could be included in the follow-up.
Yes, that would be great. I was going to touch base with him anyway, but please do that. And I did note in the email that I sent out that asking for suggestions, it does need to be sent to you as well. So that's, I would have included that in the email that I'll send out with the priorities. But I still would like to check on whether this voting procedure works. So please let me know once you talk to him. That's Liz, for Liz, okay. Okay, any other comments on this? No. All right. I just wanted to let you know, I did hear, I haven't gone through the whole budget, but I did hear that there was an increased funding for the Sheriff's Department. There was no major increase for public health. Is that correct, Olivia? Do you know?
I'm not sure what, because I did not look at the sheriff's numbers, so I do not want to comment on that.
But there was no significant increase for public health funding? Is that correct?
We have actually received quite a bit of funding from the state and federal government. Most of it, of course, is for COVID relief. Right. I don't think that we put in any specific request for additional funding. Linan, is that correct?
Correct, other than a small amount of funds to be able to match with California Children's Services for the staffing, where we had that small shortfall.
So I'd like to just put this in context, because I do recall quite a long time ago, Olivia's predecessor, Glenna Trochet, had pleaded with the Board of Supervisors about funding because there were significant cuts, repeated cuts over time. So this is a long-standing problem. I don't believe in the interim till now that there has been funding restored or funding that has kept up with the issues in public health. So it's probably, correct me if I'm wrong, to say that for it, we won't even consider COVID, but in general, public health has been significantly underfunded for decades. Is that correct?
That is correct, yes.
Yeah. So, so even when the funds from the state and the federal government are spent, and COVID, whenever that endpoint is now will become more manageable, we still will face a huge deficit in the funds needed to function as a public health department within Sacramento County to the level that is needed.
True, and we have submitted, like for example, with the ARPA, we did submit our request. And of course, we are anticipating that there'll be more federal money coming. But I think also the way that the county budget is set up is that it's dependent on us putting in budget requests, and for this year, we did not put in a lot of requests, partly because a lot of our focus has been on COVID and we are getting funds for that. But as far as more long-term, I think that's something that we are continuing to review and look at. So it's kind of, I'm sorry, I'm not answering your question as directly as you want, but just to tell you that it's not a straightforward answer.
I understand that the funding streams are different, and but thank you. I appreciate that. Okay. All right. So if there's no other discussion on this item, I'll move on to an update from Libby on the subcommittee, what we call a working committee for correctional jail health.
Thanks, Farla. I'll make it quick, but happy to answer any questions. So I think since the last update, we've sort of continued in our interview process, talking to different people who have various perspectives and insights on different aspects of correctional health. I think we had a great conversation with the prison law office recently that was very insightful and helped us kind of think about sort of what some of the gaps are and what progress has been made in their perspectives, what some of the pending gaps are, triangulating that with the conversations we've had with Dr. Damiano and others. A major development that relates to our work is the establishment of the Public Safety and Justice Agency. I hope I got that right. I think we all change the name every time we say it out loud, but the establishment of that agency should have implications for this work, and at least as described to me by Supervisor Kennedy, the top 3 priorities of the Deputy CEO who will oversee that agency should include correctional health and compliance with the May's consent decree. So those are sort of the 2 big issues we've been looking at. So I think what we're hoping to do is that person is supposed to get, the Deputy CEO should be hired roughly by October is what we've heard. So that agency is kicking into gear. I think we're thinking about what can we kind of pull together in the next 4 to 6 weeks, just sort of summarize what we've learned, what we've seen as themes, what we continue to see as gaps, and where we think this person and this agency should focus their efforts. So kind of pivoting a little bit, I think, to deal with this new development, but continuing to think about what our short-term and our long-term scope will be. So I guess the other sort of key update is that as a working committee, we've been working on establishing membership and reaching out to community members. Phil is not on the line, but he's been leading kind of the process to confirm applicants for the community positions. And we should be doing that hopefully this week, wrapping that up. We will then be a committee of 4 PHAB members, 3 community members who will meet every other week-ish. And continue to sort of divide and conquer, keep having conversations, keep learning, and try to pull together something that we hope will be useful for the new agency as well as for the board. It was a bit circuitous, but hopefully that was a helpful update. Let me know if there are any questions.
I just want to mention that there is still on that committee 1 vacant position for a PHAB member, which would also open up a position, another position for a community member. So it would be 5 and 4 rather than 4 and 3. So if anyone's interested, please don't hesitate and let myself or Libby know.
Yeah, that's right. Thanks, Carla.
Are there any comments, questions? Okay. Thank you so much, Libby. I know it's been a lot of work. There are so many moving parts and so many entities, documents. It's not a small task, but I think the committee's been doing great work. So thank you.
Yeah, absolutely. I think it's been a learning process for us all.
Yeah. All right. Okay, so I will open it up to any public comments. Come to that point. Having seen none, I don't see any hands and no comments in the chat, so I presume there are no public comments. I thank you so much for attending, and I will definitely be sending you emails. So